Hello, today is Thursday, November 13th, 2023. My name is Catherine Lee. I'm interviewing Arilis Hernandez for the Voces Oral History Center at the University of Texas at Austin. Please know, Ms. Hernandez, that this recorded interview will be placed in the Natty Lee Benson Latin American collection at UT Austin. If there's anything you do not wish to answer or talk about, I will honor your wishes. Also, if there is something you want to talk about, please bring it up and we'll talk about it. Because we're not conducting this interview in person, I need to record your consenting. So I will ask you a series of 5 questions, and please say, yes, I agree, or no, I do not agree after each one. There are 2 questions we need to make sure you agree to. So before we go on, Voces wishes to archive your interview along with any other photographs and other documentations at the Benson Library at UT Austin. We will retain copyright of the interview and any other materials you donate to Voces. The first question is, do you give Voces consent to archive your interview, for this case, audio only, and your materials at the Benson Library?
Yes, I agree.
Do you grant Voces copyright over the interview and any material you provide?
Yes, I agree.
Do you agree to allow us to post this interview on the internet where it may be viewed by people around the world, for this case, audio only?
Yes, I agree.
We have many questions in the pre-interview form that we have already filled out. We use that information from the pre-interview form to help in research. The entire form is kept in a secure Voces server. Before we send it to Benson, we will have stripped out any contact information for yourself or your family members, so that will not be a part of your public file. Your public file will only be accessible at the Benson Library. The 4th question is, do you wish for us to share the rest of your interview in public file available to researchers at the Benson?
Like my contact information?
It will only upon request and the work email address that
Yes,
was filled out. Yes. And the 5th question, on occasion, Voces received requests from journalists who wish to contact our interview subjects. We only deal with the legitimate news outlets. Do you give consent for us to share your phone numbers or your work emails with journalists?
Yes.
Okay, thank you so much for answering the questions. And let's jump into the interview. So the first question, we're gonna ask some board question about COVID-19. So first, tell me a little bit about your experience with COVID-19.
So I had moved to San Antonio a few months earlier, and was as this new assignment as a border correspondent for the Washington Post. And so I guess my focus with COVID-19 was largely on whether they'd close the border or not and what would happen with border policy and immigration in general. But I would be lying if I didn't also sort of mention my deep-seated fear for my parents, one of whom is diabetic.
Yes, we'll dive into that later. And how did you first learn about COVID-19?
Well, as a news organization, we were following it quite closely. Sorry, I need to plug in my computer. We
You're
were
good.
following it quite closely, and so we knew something was going on. And specifically with me, I was actually sent to California to try to find patient 0 when we first sort of got wind that something was happening. And then I quickly came back to San Antonio because San Antonio became a place where some of the earliest patients that were evacuated from cruise ships were taken for medical screening and whatnot. And so while during that early period, one of the patients was sort of preemptively released, and that caused all kind of uproar in San Antonio that this disease was now out in the community.
Yes, and what's your first initial reaction to the information about COVID-19, especially when you're contacting with the patient 0 in San Antonio?
I think it was bewilderment. I don't think we knew what exactly we were looking for. I never found her. I drove all around the sort of Vacaville and San Jose and a bunch of places sort of in that Santa Clara County area. I never found her, and I remember just being sort of bewildered as to, not that this wasn't real, but what this meant and where we were headed.
Yes. And at what point and how did you realize that this COVID-19, the whole thing was so serious? Or
I think I took it seriously from the very beginning. The colleagues who were sort of reporting on the science of this and the health risks of this made it pretty clear from the beginning that this was really bad, and that we needed to take it very seriously. So I think at no point did I not take it seriously. But again, we had so little information at the beginning that it was difficult to gauge what the appropriate response should be.
yes. So, how has COVID-19 impacted you personally?
Um, well, I didn't get it until much, much later in the pandemic because I took the warning seriously. I
Mhm.
was the Post actually sent us gloves and masks and hand sanitizer to those of us who were out in the field doing work. For the most part, I stayed home for a lot of it, but at one point it became clear, like, I hate being at home. I hate doing journalism by the phone. And I need to see, I need to feel, I need to smell. And so at one point it became untenable to do journalism just from home. It was a very scary time. It was depressing because, again, I had just moved to San Antonio and I had wanted to expand sort of my social circle and get to know the city, and was prevented but from doing that because of this virus. And so professionally, there was a moment early on where I was it was sort of like a rallying moment for journalists, I think, across the country, and particularly at the Washington Post, to, like, this is our moment, that we have to do our duty and inform the public and keep them abreast of what's happening and do our best, right? And so I
Yes.
was committed to that at the very beginning. After a while, it just got harder and harder to maintain that same momentum because so many of the stories were so dark.
Yes. You mentioned that your parents have diabetes and you moved to San Antonio. Did your parents move to San Antonio with you?
No, my parents are in the Washington, D.C. area where I grew up,
Yes.
along with my sister, who was having a baby at the time as well, or she wasn't yet pregnant, but she was in that process. And my father is incredibly stubborn man and hates change of any kind that feels imposed on him by society. So, we had to threaten him, my siblings and I, about, not go do his daily trips to the hardware store, not go out to the CVS that he loves. It's part of his, like, retirement routine, right? He's going to pick up his prescription pills and that kind of thing. We really had to threaten him and keep him from going to events because he also belonged to a church community that is rather skeptical of government mandates. And how do I put it? Doubtful of the seriousness of what was happening. And, even though he's not of that same perspective, it's incredibly tempting to pretend that life can go on as normal when this infectious virus is around and we had very little information about it. So I was most scared for him.
Yes. So did your father ever told you that how COVID-19 impacted him?
My dad is not a man who talks about his feelings. I think, but from the conversations that I had with my mother, I think I could gauge that he was incredibly bored. And when my dad is bored and not doing something and not providing and not, all of those things, he gets pretty depressed.
Yes. How did that impacted your family relationships during that time?
I mean, I think for a little while they were pretty tense because I was adamant with my father, and my dad is defiant by nature. You cannot go out. Like, I'm literally writing about people who are dying because of one thing, because of one event, family gathering, whatever. Like, it is not worth it for you to take that risk. And he would get mad about, family events being canceled or gatherings. Like, my sister and her husband go to my parents' house every Sunday for dinner. They had to stop doing that. And I had to like get my brother and sister come along with me. My brother is like my dad, and it's also very defiant, um, and thinks he knows the best. Was even talking about not getting the vaccine early on. So yeah, it caused quite a bit of tension.
Yes, you mentioned you moved to San Antonio and don't have a lot of friends. So, how has COVID-19 impacted you and maybe your neighbors or your friends that you know?
I couldn't say. Like I was so focused on the work at that time that there was sort of little social engagement with people actually in San Antonio. Like I knew a lot of people from before. I've traveled here before, but I hadn't sort of made deep relationships with folks. I know it was traumatizing and difficult for a lot of people. I was mostly in touch with friends back home,
Mhm.
and in other parts of the country who were struggling again with being sort of homebound, struggling with trying to figure out what was the right thing to do and trying to force other people in their life to do that right thing or
Mhm.
to convince them of the righteousness of that. Uh, again, I think it was just an extremely trying time that lent itself to like doomsday thinking, if you will, and wondering when it, if ever, it would end.
Yes, you're a board member at National Association for Latino Journalists, right?
Hmm.
Yes, and can you recall that how has COVID-19 maybe impacted the association itself?
Yeah, we had to cancel our convention that year and go virtual, which was
Mhm.
extremely difficult, and it wasn't the same experience at all. I forgot to mention, I'm also run a high school journalism program for the Asian American Journalists Association. That was the first year ever that JCamp had been um, sort of canceled or moved. Well, we canceled it altogether, and then the following year moved it to virtual. So a lot of the activities of both organizations moved online. Um, and that was difficult, but it was also new and interesting. And sort of, I think to some degree, there was so much starvation or of social contact that the meetings for these organizations became very healing and very necessary as part of as time went on.
Yes. And generally, how is going out into the world during COVID-19 different from pre-COVID period in your perspective?
I think uh, you're much more aware of what the cleanliness and hygiene that you practice
Mhm.
in terms of washing your hands pretty regularly. I mean, I always wash my hands, but it certainly got a lot more intense
Mhm.
with the pandemic, of using masks. My mother made us masks that she sewed herself and sent out to all of her children. Um, but also like switching from the cloth mask to the actual K9 N95. So like scouring the internet and Amazon to send you that kind of stuff. That was the other thing that I like everything got ordered in Amazon. I didn't want to go to the grocery store, so I had it delivered, or I would do a service where I'd order it online and they put it in my trunk, and so there's no contact. Um, let's see. I carry around hand sanitizer, I think more deliberately.
Mhm.
Um, and I'm just more conscious of the risk that I take with certain events, and like I'm much more prone to go to an event if it's outdoor, rather than indoor, especially in the winter,
Yes.
and judge whether something is worth going to based on the number of people who are going to be there.
Yes, earlier you mentioned that your parents are in Washington, D.C.
Hmm.
and you're in San Antonio. So how has COVID impacted your ability to gather with your family and friends for those important events? Because you also mentioned that a lot of family events was canceled because your parents shouldn't go out.
Yeah, so there was no Christmas that year for me. I usually go home or they come to me. And I did not have Christmas that year. I celebrated it by myself for the most part. And then the following year, I think I also stayed. It's hard to remember those years, but I think I also stayed um in San Antonio and like celebrated a little bit with one s- distinct friend, right? Like we made food and had drinks, but that was sort of like it. It was limited to sort of these small group gatherings. The other thing that we did was there were a lot of Zoom calls where we, like, the family and our extended family would play games and try to use that as a means to keep motivating each other. So that happened several times throughout the year. And even when the Nationals won the World Series in, I think it was 21 or 20, I can't remember when, we watched it together using, like Roku or something, group watch or something like that. So we like use technology to try to bridge the gaps of not being able to see each other in person. And then finally, my mom was the first person who traveled to in 21 on spring break to visit me.
Yes. So during the pandemic time, who have you interacted with mostly and why?
My editors, I
That makes
think.
sense.
Yeah, I think mostly my editors.
Yes. And you mentioned that you were in a high school journalism program.
I'm part of a
Yes.
leadership group that runs a high school journalism camp. Yes.
Yes. So how has the COVID-19 changed the way that your community or received education, especially in this program that you're running?
Yeah. So, I mean, J Camp is sort of built around building relationships and community. And that was really difficult to do when we couldn't be there in person. And so the first year, we just canceled it because J Camp is not J Camp if we're not together in that way. The next year, we decided to do, instead, in place of the year we canceled, we did like an alumni summit where basically everyone joined online and we shared stories and memories of J Camp and ideas for how we want as alumni to plan for the future. And then the year we did it virtual, it was really heartbreaking because they were fantastic students. We reduced the class to, usually we have about anywhere from 30 to 42 students historically. And that year we had about 12 students that were great, that were fantastic, and we would have loved to have met in person. Instead, we use Zoom and some other like game consoles, whatever, to try and, supplant some of those bonding experience that would now normally happen in person. They were wonderful, but it was really sad for them.
Yes. Did any of the students in the program mention the impact of the pandemic for their education, especially for this program?
Yeah, and it came out when we went back to in person the year later, in the essays from students who are applying, how anxious and depressed they were, and how difficult school had been for them, and how unfortunate it felt and unlucky it felt to them, especially because we're talking about juniors and seniors in high school, that they're going into college virtually, like they're not even having like the real college experience, or the traditional, if you will, college experience, because they were stuck at home. So it was hugely impactful to the students, and their self-esteem and their sense of self-worth, um, and planning or having any kind of optimism about the future.
Yes. So in this journalism program, is there any students mention how journalism helped them to get through the pandemic?
I can't recall specific
Or
commentary.
yes, or do
Um,
you think that the journalism program will help the students to gain a better aspect of the world, especially
I
in pandemic
do, I
time?
do, I do, because I think being around other students who are just as motivated as you about and passionate about something like journalism is in itself very like confidence boosting, right?
Yes.
And as the mentors of that program, we exist to try and instill confidence in these students because we need them and the industry. A lot of them ended up, that group of 12 or so ended up going to journalism school, and to Harvard and Columbia, and then to Northwestern. So I think it was incredibly impactful to them and reassuring that like journalists, professional journalists, were willing to create this and maintain this for them in a year when the world was seemingly falling apart. to say that you matter, this matters, what you're passionate about matters, and that you should continue on your path.
Yes. And have you been in any kind of education during the pandemic?
Like taking classes or anything like that?
Yes.
I mean, for a while, like my brother-in-law sent me a guitar. I was taking guitar lessons for a while.
Yeah, guitar lessons is so much fun. Like, what kind of challenges have you faced in learning something new during the pandemic times?
Oh, I didn't learn it well. Uh, it was sort of staying focused on trying to accomplish a goal because I spent so much of my time doing work and planning the next story. And I just worked like crazy during that time. And it was not good.
Yes. So, did you get your vaccination?
As soon as it was available.
Yes. When you get your first vaccination, what was that like? And can you describe a little bit on how you got it scheduled?
Yeah, so I really wanted it. Have asthma, and so I was a little bit afraid of or nervous about the respiratory effects of COVID, and I just wanted to protect myself. I believe in vaccines. And so when I tried to get one in the San Antonio area, I um I couldn't find a place to get it. San Antonio, there were a lot of people who were interested in having it, and there's a large elderly population here, and so they were prioritized to some degree. And I should know that I like regularly got COVID tested when I did work. So like I'm COVID tested probably 1,200 times. I'm exaggerating, but probably like 1,200 times during, and it would be these little outdoor booths with a RN inside, and whatever, that whole thing. And then they send you email or a text message saying, you're positive, you're negative. Um, so when I heard from a colleague on our team that the best way to find a vaccine would be to go to seek out pharmacies in areas with large Republican communities, because they don't want the vaccine. So that's what I did. I got the shot in Bandera, about an hour away, scheduled an appointment in this country town, and have been getting my vaccine, all but two of my boosters, at that same place. It's supposedly the oldest pharmacy in Texas.
Yes. And moving to healthcare, so what kind of concerns or questions about healthcare have emerged as a result of COVID, like in your own life?
I got it in 2022 for the first time, in June 2022. So I kept myself from getting it for a long time. I think I was concerned about the long-term effects, because even to this day, I mean, I have allergies and I regularly get sinus infections and that kind of thing. But I was mostly curious. I was noticing that my sinus infections were far more dramatic and painful and lasted longer post-COVID. As an asthmatic, I was really curious about the damage done to my lungs through that time. And I had a friend who had a very severe reaction to COVID that left her, which I think it was like long COVID, which is what is now known as long COVID. But I mean, she was close to death's door with COVID, and was a generally healthy person.
Yes, have COVID-19 impact like your accessibility to healthcare?
My accessibility to healthcare. I don't like going to the doctor. I never have. I think healthcare is a scam. No, I'm just kidding. I do think that our healthcare system in this country needs a lot of work, and so I'm not super trusting of it. But both my mother works in healthcare, so it's more of a ding towards her. Or worked, retired from. I don't think my attitude. I believe in vaccines and that type of thing. I don't think my attitude towards healthcare in general. I mean, I regularly, well, I did not have a primary care doctor for almost 7 years, and I did get one afterwards. But I think that's more like finally admitting you're an adult versus any attitudes that would have changed post COVID. Um, you know, no, I don't think it changed too much other than uh, a general respect for those who worked on the vaccine and did what they could to normalize our
Yes.
our world.
Yes. Did you get a second or a third dose of vaccine?
Oh yeah.
Yes. And you mentioned your mother worked in healthcare sector. So, do you have a story of did your mom get vaccinated and did your
From
dad
the
get
very
vaccinated?
beginning, from the very
Yes.
beginning.
Yes. Is there any after effects that your parents have reported about a vaccine?
No, I think just in the immediate aftermath, there was like some mental fog and some, exhaustion, but nothing serious.
Yes, you also mentioned before that Washington Post sent you the healthcare packages for COVID-19. Um, so have other of the organizations that you are part in have provided resources regarding to COVID-19?
Um, well, NHJ, the National Association of Hispanic Journalists, would send like, alerts and was I think we organized some kind of safety workshop for journalists and also some language people could use if they wanted to say no to certain assignments, that kind of thing. So it's more of a like rhetorical toolkit rather than like sending out masks or hand sanitizer. Um, yeah.
So also in your coverages at that time, did you mention any kind of the healthcare reminder in your coverages or?
I mean, all my stories were warning stories. um, I wrote a story about how devastating the impact had been in the Rio Grande Valley, which is largely Mexican American, Latino, and where a lot of the culture revolves around family and family gathering. And so I wrote a series of stories about how those family gatherings had infected and killed off entire generations of families, and how painful that was for so many people in that region. I also wrote stories about a Hispanic family in Dallas who struggled between generations, either because of their ideological beliefs or their just beliefs about life in general, had different responses to the vaccine and were struggling to reconcile and not fight with each other over that. I wrote a series of vignettes about essential workers who were Hispanic and who had no choice about whether they had to go out into the world and keep working and getting infected, and sort of the remedies that they use to try and some cases save themselves, in other cases, could not save themselves. Um, so I focused a lot of my coverage on Latino families because I think they were the least sort of positioned to stay home during the pandemic, like, you know, or not as an ethnic group, but as a working class, right? Least positioned to be able to leave home and left with more choices, fewer choices and more risk.
Yes, you mentioned your coverage in Rio Grande Valley. Could you elaborate on that story for a little bit?
Yeah, I was personally devastating to me. It was just, I remember going down there and just feeling as though the entire region was enveloped in mourning, right? Like there was a pall of grief that hung over. You could feel it in the air. And there were visuals too, right? So for that story, the story was about I hooked up with a curandera, a folk healer, and to sort of get a sense, because there is sort of a subculture, or no, a culture of the Rio Grande Valley, of where there's a lot of people who are uninsured, and so instead of going to a doctor that might charge them through the nose, they will, some families will go to their folk healer, their curandero, or, resort to teas and other home remedies to try and protect themselves against. This is pre-vaccine, of course. And so there were things that you see like outside the hospitals in McAllen, family members like with signs and praying together for loved ones who were inside the, if you remember, the coils coming out of certain rooms, that because they had to do something to the air purification for folks in the hospital. It was the grotto, which associated with the Catholic faith, with all kinds of medical bracelets and little trinkets that people would put with prayers asking for their loved ones to be saved and protected from COVID. It was just such a horrible time there.
Yes, you mentioned they use remedies like before the vaccine came out. Did they report the remedies helped at all?
Some people did. I don't know how much of it was a placebo effect versus any other physiological, biological things. For example, during that story, in fact, I was visiting folks who lived in colonias. Colonias are communities that are connected to sort of the community, the county, or the official government infrastructure. So they don't have running water in the same way that you and I might have living in the city or whatever. And they're usually undocumented. And while we were out there, the lady hands me a little bag of dried leaves of eucalyptus to make a tea, because that's what they were relying on to protect themselves. Eucalyptus tea and any other kinds of tea that they could make for themselves. Vicks Vapor Rub was a big one. And yes, it did make people feel good. I think there were tonics and things like that of, herbal plants in the area. The Rio Grande Valley is actually historically has a huge inventory and habitat of medicinal herbs and things like that, and trees and things like that. So people were trying to find out what these things were to protect themselves.
Yes, and do you think that your coverages about the communities changed the way that Latino communities view COVID-19 and helped better protect themselves?
I don't know. Those are, I think, really difficult to gauge because even the people who I interviewed for a lot of these stories aren't Washington Post subscribers. They're not regularly reading my particular coverage. I do think, and I hope that it gave voice and visibility to a community that was really struggling and needed more resources. And I don't have documented evidence that that happened, but I do think that that meant something. And whether that changed how the methods they use to protect themselves, I think information is a powerful tool to navigate this particular society.
Yes. And after your coverages, are the Latino communities, do you think they're being like heard and being helped more?
I hope. I can't say that it did, right? But I do hope that in elevating those stories and those perspectives, that particularly to policymakers and lawmakers, that they understood the particularities of these communities and that it would shape, if not in that moment, future thinking around when the next pandemic comes, when the next germ turns into a global issue. They're able to look at these stories and developed and create and devise policy around that to make sure that these communities don't suffer in the same way they did.
Yes, and earlier, you mentioned that you have to go to a Republican drugstore to get vaccinated. And how do you believe that politics affected how COVID has been handled?
Well, to be clear, it was a Republican area. I don't know if the
Okay, Republican
itself was
area.
Republican.
Okay.
It was more conservative, certainly, than San Antonio. Well, because the prevailing wisdom at that time was that more conservative individuals, particularly members of the Republican Party, were highly skeptical of the vaccine, and more so, I think, of the fact that government was mandating it in a lot of different ways. I mean, local government as well as federal and state government. Texas, it wasn't exactly mandated, but people were already fighting over the masks, which were mandated at one point and then rescinded. And so there was a lot of angst and ideology and misinformation that was permeating, particularly or resonating, I should say, in communities that traditionally identify as more conservative. And so when the batches of vaccines went out to different communities, San Antonio is one of those places which is more left than those areas. Those vaccines were difficult to find, whereas there were plenty up in Bandera.
Yes. And how has COVID affected politics in your area, especially San Antonio?
I think it's affected everything, right? San Antonio is a city that is largely, I think, Democratic. I think it's safe to say largely Democratic and led by a Democratic leadership. And they came into persistent conflict with the Republican legislature and the Republican governor over how best to protect people, how best to um, balance the needs of the many versus the needs of the few. And so it was like watching, it was just a constant battle, and we wrote about it plenty of times. And it led to, even today, efforts in the state legislature to strip city governments and local governments of some powers that they have originally, long enjoyed in terms of the sort of the ethic of local control in Texas history, or Texas political history, that is. So it affected everything. And in terms of like individual relationships, I mean, people are highly conscious now of derms. I mean, they were before,
Yes.
but definitely far more now, and are conscientious, particularly in the winter when you have sort of a conglomeration of viruses that are going crazy with the flu, the cold, RSV, are conscious about when they plan events. I mean, what is San Antonio's big food place? There's tons of restaurants. Everyone has sort of adjusted to either a drive-through model or some kind of carry-out model. I think it accelerated the move to using apps and platforms for ordering food. I think Uber Eats went crazy here in San Antonio. The curbside pickup for large retailers in San Antonio, and HEB in particular, which is a Texas-based grocer, is still exists for people who are nervous, and people still mask, in, for all of the requisite reasons.
Yeah. So your parents live in DC, and have they told you how politics in their area changed their life?
So it's different, right? Because
Yes.
Texas is much more conservative. DC is not generally, right? It's more blue, and DC and Maryland, they live in suburban Maryland, and just outside DC. And so everybody sort of stepped to when it came to masks, when it came to staying home, when it came to vaccines. There was a lot more compliance with this ethic for public good there. And so it wasn't as stark as it was here in Texas, and at least the divisions, I should say. In terms of the politics, I mean, my dad was tired of wearing a mask. Like he has anxiety over some breathing issues that he has. Like he uses a CPAP, like many people his age, CPAP machine to sleep for his sleep apnea. And so the mask really irritated him because it gave him a sensation of anxiety that he couldn't breathe and that it was hot. So he really hated it. But the politics of his area were such that if he were to take it off or to not, or forget it in the car or whatever, he would have to go back to the car and go get it, because they weren't going to let him in the store, and they weren't going to let him in this place or that, or people were going to start looking at him weird, and he hated that. So in that way, I think he was impacted by the politics. But in general, like my parents' politics align pretty specifically with where the state is, and state in the region.
Yes. So a follow-up questions to when you're doing coverages about Latino communities. So During your covering of that stories, did you face any confrontations or conflicts with people who are hostile to journalists?
All the time. I can't remember specific uh incidents right now, but I know there were many, 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 many conflicts. Like, um, I had to travel a lot. I covered a Trump rally during the pandemic, and the protests, right?
Yes.
So, if I was wearing a mask, that was like an automatic signal to folks who oppose mask mandates that I must not be on their team, right? So that sort of made a target, and for the most part, I think I just ignored. No one ever put a hand on me or anything like that. I think the closest that I got to being scared was like brushing up against a Proud Boy in Tulsa, Oklahoma. But um, I did wonder sometimes if I would be more effective interviewer, if it would be more effective reporter if I took the mask off and tried to help that person feel a little bit more at ease with me and my questions. But it got really tense, always if they wanted to know where I worked, and if I said the Washington Post, it was this is automatic, yeah, I don't talk to you. Or no, I'm not going to listen to you. There was one story, actually, now I do remember a specific incident. There was one story about, I reached out to, I think, a business in South Padre Island about lockdowns because they had opened during what was supposed to be spring break, and South Padre Island is a huge destination for spring breakers. And I think a lot of people had gotten sick. And so I had called that business and got a mouthful on the phone, really, really nasty. Um, and then later they called to apologize though for the outburst, because again, they had made all kinds of assumptions. Sometimes when I make calls by phone, some people wanted to know like where I stood, as if that was again a prerequisite for my ability to interview them fairly. So I spent a lot of time trying to talk people down, but I don't think it was as much the ideology as that people were just tense. People were just stressed and anxious, and I had to spend a lot more time on the phone and in person trying to ease and build rapport.
Yes. Oh, so can you go a little bit specific on how you built this kind of rapport with those people who are not willing to talk to
I
you?
Yeah, I would just let them scream at me. I would just let them scream at me. I'm like, okay, you got that out of your system? All right, good. Now here are
Yes.
my questions. Or I would explain, really deeply about where this is going to appear, how I plan to use it, which I think I do most of the times anyways. But I spend a lot more time sort of just like, it's going to go in this story, and this is what the story is about, and this is the premise. Um, and what else did I do? I would read back quotes on the phone to them, like of our conversation. This is what I'm planning on using, and that could change, but this is what I'm planning on using. Are you okay with that? Or I would follow up after the publication and check in on them. And sometimes it was just a matter of listening. People just wanted space to talk to someone, and sometimes a complete stranger is the most comforting person to do that with, because I'm not going to judge them. I'm listening. My job, I'm a professional listener. At least that's the way I think my job works, and the way I practice my journalism. So I spent hours on the phone when normally I might do an interview in 20-30 minutes.
Yes, and I know that in pandemic times, we're in a world of misinformations and are journalists covering the stories. How did you navigate in the world of misinformation?
So again, if memory serves me well, um, it was extremely difficult because the research was happening in real time, right? We were learning what this was all about in real time. Like, for example, I was one of those people who wiped down with Clorox sheets all of their groceries after picking them up, in my trunk. And it turned out that COVID can't be spread on surfaces. And that was one of those things that we had to like debunk early on, right? Like, but that there was a whole cycle of that where we would state something and it would be true for a little while. And then like more would be learned and the guidance changed. Or, you know, the CDC wasn't super clear about what measures people should take. And for example, I'm trying to remember, particularly with gathering, like how many days after exposure should you isolate and how long, and all of that just kept changing, and these are moving targets. And so, you know, the misinformation was coming. Again, there were people who were deliberately fabricating information, right? And then there were the people who are the official forces who kept changing it because the research would change, because more research was available. But then you had a public that was largely getting tired of, you know, what the changing nature of the research and the information, and decided at some point to just tune out, or lend more credence to those who were intentionally fabricating information because that was easier and more comforting than the truth.
Yes. So, how has COVID impacted your work in general?
Well, I'm certainly a lot more careful. And I do wear masks, I think, more often when I'm reporting. For example, I spend a lot of time on the border with migrants. And I was particularly conscious about COVID once things opened up a little bit, about COVID spreading inside of migrant shelters where I spent a lot of time. And so like I would wear masks even though I knew that was like uncomfortable for some of the people that I was interviewing, or I gave them a mask. Because you know, some of these people had been vaccinated, but some of them had not been. And through no fault of their own, because they just crossed the border and came from Mexico. So definitely changed my approach to situations where a lot of people gathered in a small space.
Yes.
I think it changed my reporting in that I am a lot more, I think, empathetic as a reporter now, because of some of the experiences that I had during the pandemic, including interviewing the mother of a child who died suddenly from what they believe is a disease linked to COVID exposure. That was one of the hardest interviews I've ever had to do. And it was just dreadful. And so I think I'm a lot more empathetic and a lot more patient with people. I also, I think, realized that it's really important to balance my own life because I do work so often. I think I'm probably a workaholic. And at some point derived some of my self-worth from the work itself, and how often I was producing and how it was being received by my editors and by the public. And there was a moment of realization throughout the pandemic where I, you know, separated those two things, that my worth comes from my essentialness rather than whatever I produce. So I do think I approach my work differently now, more maturely perhaps than I did before.
Yes, you mentioned you are reporting in a shelter and sometimes they feel uncomfortable because you're wearing a mask. And even when people are wearing masks, sometimes they could still get infected. So did you ever get scared or fearful? And did it ever change your mind of stop going out to report the stories?
I really love reporting, so I can't recall that it actually stopped me. I mean, I literally we produced an award-winning series about George Floyd, and I spent time with a family from the neighborhood where George Floyd is from, in Third Ward in Houston, and that lady called me when the weekend I was supposed to go interview her and spend time with her and her son. She called me to let me know she had COVID, but we really needed the interview. And I talked it over with my editor. I wore like 3 masks that day. She had COVID, but I was there in her house with her And we did the interview, and I think it also meant something very deep to her about how far we were willing to go to hear her out and hear her story and get it down and record it as well as we could. So I don't think it stopped me. It certainly made me pause and have more considerations. And there were times when, like, my face is a tool for reporting. So when I'm interviewing people, like, I like to look straight into their eyes. I want them to know I'm listening and paying attention to them. And I'm reacting with my face. And that's all part of the experience, right? And the exchange of humanity that's taking place. And so sometimes wearing a mask, like, cuts some of that off, right? Like, they can't see my face. They can't see how I'm reacting to what they're saying. And I can see the effect that it has on them. So sometimes I would just, like, rip it off and be like, screw it. This person is more important than me in this moment. So
Yes. And you also mentioned that you are reporting stories around the border. So do you have any worries about those people's documentation status? You don't have to disclose any names, of course.
um so remarkably, like, I never caught COVID in those situations. And I think in part because a lot of those people had not been exposed yet to COVID. Because they were traveling, they were outside all the time. I don't know what it was, but for the most part, like, I never encountered an immigrant at the border or in, post crossing who showed symptoms of COVID,
Um,
or who, is that what you meant?
I meant the documentation status. Like maybe some of them are undocumented, so
All of them would be.
mhm.
Most of the people I would were didn't come in with, like, legal permission or had requested asylum protection, which is a specific legal process. It gets really complicated, but most of the people I met didn't have, like, official permission to be in the country, but were seeking it out, or were in the country without it in general. Uh, I was, I think, more worried, and I wrote about the undocumented migrants in Texas who work in essential industries, not so much the folks at the border. Some of them did become infected once they were, in Houston, in Dallas, in Austin, working construction or whatever. And I have a couple stories where I looked at construction workers in specifically, who for the most part were undocumented, and not only do they risk getting infected by COVID at the time, they risk losing their jobs and their livelihood, and falling into very serious circumstances.
Yes, do their documentation status affect them to access to the healthcare and vaccination?
It depends where they were. If they were in one of the big cities that I said are a little bit more left-leaning, um, there were groups and organizations, particularly in Dallas, clinics that served specific undocumented populations, and they were able to get it. The United States, as the government, basically sent a mandate that it didn't matter whether they were undocumented or not. They should be able to access, at least the vaccines and basic COVID tests. Now, further treatment is a totally different issue, and that depends on the place again, and how their ability to pay. In the Rio Grande Valley, for example, these are people who probably could not pay for if they got really, really sick and had to be there for an extended period of time, which happened.
Yes, how
Um,
do they deal with it?
well, I mean, the Hippocratic code of doctors and physicians is that they'll treat anyone, right, for the most part. But that puts those hospitals in some financial peril. Most of the times, not most of the times, I'm unfamiliar with exactly how this works. Some of those hospital systems build in contingencies so that they are able to take the financial loss, especially if someone died in their facility and had been there, say, like months or whatever. Or in some cases, there's a limit to how much of that financial hit they're able to absorb. And so they'll send those people home, and they die at home. That happened also a couple times in some of my reporting. But it's not uniform across the country. It's sort of a patchwork of policies. But for the most part, like, a hospital has to admit you regardless of your status. If you are, if you're sick and showing symptoms, how long you stay, how that treatment plays out is all dependent on the individual hospital.
Yes. So, during the pandemic time, do you have any concerns about finances?
Me personally,
Like, do employers cut your bonuses and wages, something like that?
um, I am quite privileged. And in the case, it was one of the years where we did well as a company because people were looking for information and people were stuck at home and were going to our website and becoming subscribers. I can't tell you exactly like how much money we made or what that looked like, but I don't recall feeling ever in danger of losing hours because what we thought we were playing an essential role and democratic role in informing people about this. So no, I there were layoffs later, but not at that point.
Okay. And how have your work have shifted, like how your duties as a reporter in Washington Post shifted, like in the pandemic times?
Well, I was more of a generalist during the pandemic. I would help with every kind of story. And I mean, I'd be writing about hospitals and I know very little about hospitals, or I'd be contributing to bigger health and science stories, which are not a part of my beat generally. And my beat is sort of my area of coverage. And so during the pandemic, I was like doing everything. I was writing about everything, whereas like now I've sort of shifted back to border and immigration, specifically in Puerto Rico.
Yes, and looking back now, how did the experience during the COVID-19 of your like reports have energized your commitment to journalism? You mentioned empathy, and could you elaborate on that story a little bit?
Um, I'm a true believer in journalism. I don't think that's wavered over, well, that would not be true. It did waver during the pandemic a little bit, because again, of that doomsday thinking of, oh my gosh, let's reevaluate my life. Do I really want to be doing this for the rest of my life? Is there something where I can be more helpful to humanity and to my country doing something else? And so there was a lot of those doubts that were running through my head. I landed back where I started, which is that journalism is my calling or my vocation. And I'm going to stick with it. But there was some wavering during the pandemic that came along with sort of a general reassessment of one's life and mission and purpose and all those, crazy things that we thought about during the pandemic. In terms of my journalism, yeah, I mean, empathy is really for me about spending the extra amount of time to listen, to try to put myself in the shoes of the other person so that I can see the world through their eyes. And, there's limits to that, but trying to see the world through their eyes, trying to get a fuller picture of their circumstances that might explain why they believe the things that they believe or why they think about the world the way that they do. Because there's always sort of like a backstory, an origin story to why someone presents themselves publicly in a certain way. And so I was more interested now and asking the kinds of questions that would lead me to a more three-dimensional understanding of who that person was, for the purposes of the piece I was writing.
Yes. What is the most memorable moments that you think in the pandemic time while you're doing all the reports?
I can't exactly recall the story, but I remember interviewing a man who had a spina bifida, I believe. He has some kind of major medical issue, disability, but he was determined to go to law school. And he had this relationship with his dad where he can't pick up books, and his dad would or write. So his dad would write his papers for him, and he would like dictate. Like they had this really special relationship. Um, and he was determined to see his son realize every dream that he had, despite his disability. And all of that became really difficult during the pandemic because his dad got COVID and ended up in the hospital for a significant amount of time. And so his dad being in the hospital like delayed his ability to do anything. His dad was his arms and his legs. And he had dedicated his whole life to his son. So it was a particularly heartrending story about how COVID had robbed both of them of sort of a normal functioning. And I heard recently, about a year ago, that young man that I interviewed at the time had passed away.
That's a very
He
sad
made it through the
story.
pandemic. Yeah, he made it through the pandemic, but he died after that. And he had lived longer than I think any of the doctors had expected him to.
Mhm. And so, talking about social movements, and have any of the current social movements in conjunction with COVID-19 impacted your daily life?
Hmm. I mean, I covered the 2020 protests, I covered George Floyd's funeral. I spent a lot of time in his neighborhood in Houston. I think that the movement for social justice that summer um, certainly impacted the topics that I think I want to cover moving forward. The issue of injustice in this country and historic discrimination and segregation are all things that I think the country perhaps needs to reconcile with a bit more. And so I think it's definitely influenced the kinds of stories that I want to do, and reminded me of the real pain of racism. Uh, and it's something that I had experienced during the Trayvon Martin shooting back in 2013. I was a reporter in Florida on that story. And I remember like experiencing through some of those protests, excuse me, and some of the events around that, how like physically anguished people were by the racism that they experience and that, you know, people like them experience writ large. And so these are things that I've always paid close attention to, but I think perhaps the imperative was heightened because of the social movements that were taking place.
Yes. And have you participating in any of the protests recently?
No, I don't participate in protests. I cover them.
Yes. And if you cover the recent protests, do you think the COVID-19 still plays a part in whether people deciding to participate?
Anymore. I think again during 2020, that summer, people were sick of having been indoors for as long as they were. And though there were people at these protests that had masks on and took different tolls, I think the impetus was greater, the cause was greater than their individual health. And I think that's still the case today.
Yes. And during the pandemic times and nowadays, how do you stay objective when you're writing a story?
Um, well, I don't believe in objectivity,
Mhm.
not in sort of the way it's perhaps been articulated. I think we're human beings and we see the world through our set of experiences and our own story. So I think what is more accurate to the way that I practice journalism is that I try to be fair and make sure that my process is fair and try to be as transparent in the way I go about doing the reporting, you know, I'm explicit with the people that interview about the books that I've read or the things that or the people that I've interviewed about, as I'm trying to form thoughts around a particular issue. So I think we can be fair, and I can check my biases, and I can go through a process where I check with other colleagues and say, hey, can you read this? Does it sound unfair to not compromising truth, or where I think truth is discernible insofar as you're able to, fact check that. But for fairness to the person, and to remember that everyone involved is a human being with all that comes with it. So I'm not sure that objectivity is the goal for me so much as being fair and transparent in the process, and making sure I do everything I can not to misrepresent the people that have trusted me with the information.
Yes. And if you can send a message to future journalists or people who are interested in journalism, and what would you tell them? Like, especially during epidemic times, you're facing a lot of challenges. What's your advice?
I think I would tell young journalists to not be a workaholic like I was, but because that'll sink your self-esteem and your sense of self-worth pretty quickly. To make sure that you balance your life with other things that make you happy, that you practice self-care, not to the exclusion of being like meeting your responsibilities, of course. But really investing deeply in the relationships that matter to you, to make sure that you have a support network for the moments when you really need it. Perhaps finding that thing that you love, whether it's music or doing puzzles. I apparently love to do puzzles, or playing the guitar or whatever, and really investing in those places of your life, not just in your work life.
Yes, and that's basically all the questions. And is there anything else you would like to share about your experiences with COVID-19 that I have not asked about?
Um, I think I would just say it was really hard, and frankly, I don't remember a lot of it. I wrote in my journals, and I haven't really revisited all of, what that time was like. Um, but it was really, really hard, and perhaps more hard than I've elucidated in this interview, um, because of the very serious questions individuals in the society had to ask itself about, like, a future and what comes next, right? And there were times when you really thought this was the end. Like, this is as far as society goes. But I'm so grateful to the scientists who worked on the vaccine and who brought it about. And there were a lot of mistakes made, and I just hope that our lawmakers and our policymakers and our leaders are paying attention to the past. I'm not super optimistic that they are, but that, pay attention to what happened in detail to help guide, because there will be another pandemic.
Yes, and that's all my questions. Again, thank you so much for your time to participating in the project.